My name is Dr. Lemm. I have a clinic in Berlin and Mahakala Retreat Center in Montenegro. I'm specialized for detoxing the body, borreliosis, female health and nutritional therapy. This is my new series recording my patient in hope that can help you as well. If it does, please help us to be able to do it more, and subscribe and put a thumb. There is a good and bad message. The good message I already told you. There is a way, and this way is 100% if you do this therapy, but this therapy are so far that I know and I'm really sure it's working. Infusion. We can maybe try like a trial something else and measure, because you are also leaving now and you're not going to be able to do next 3 months infusions. So this is a really good way maybe to do the trial. But first I explain you about the infusion. The infusion who is detoxing cadmium is EDTA. And there are two kinds of EDTA, one's with magnesium or with calcium, and the one is for 1 hour, and I would recommend you to do the calcium EDTA, which is running 1 hour, and maybe after the 10 infusion we measure, and most likely that will be less. But we measure first your urine before infusion, and we measure your urine after the first infusion to see how much is coming out. So that means we are not relying only on some kind like esoteric test, which some people can think that light spectrometer is. We are really measuring the material cadmium in a urine. And the first treatment is more as a diagnostic. And we then know you have it. Maybe you want to do that today. Yes. And then we have result, and we know this is the cadmium coming out. If you have cadmium coming out after infusion, so this is the proof. If you don't have it, this is not 100% proof that you don't have it, because sometimes there are so many other toxins binding on EDTA and cadmium not so much. So we will see what is showing. But 99% all people who have Vita cell very cadmium high, this is also coming in a urine. So this will be ideal. And then we are not uncertain what is now. Yeah, it's most easy to have a treatment if we have different tests and they are matching together. Yeah, if not, we will then see what is the best way. Usually after the 10 infusion it's much less, but we cannot actually see how much. I do on myself as long it's coming out. I don't have any cadmium anymore. My cadmium is completely gone, but I have the other ones. What is very interesting, this is very good tolerated. There are not much side effects, but there are some side effects. So that means if you use it afterwards, there are some toxins left which are swimming around, and you get short toxicity. But I give some tablets then afterwards as well, also for the mercury, because mercury is also moved around, and then this can get a little bit high. Okay. You can also say, oh, I don't worry about, and sometimes I don't take any afterwards. I just take the EDTA and finished. Okay. So you can think about. But what is maybe interesting for you is, because you are gone for 3 months, there is on the market now a liposomal EDTA, which you can take orally, and we can maybe measure it also today to use very strong dose and to see, is it coming something out?
Yes, let's do that.
Yeah. And I don't know how long do you stay here, but the results takes 2 weeks.
It's okay. We will have a call. I will leave tomorrow morning.
Aha, okay.
We will have a call.
Okay, good. So, and then we will see, is it also, I haven't done that so far because this is relatively new product.
Great.
And then if it's good, we can organize that you get that there in Zanzibar.
Yeah, exactly.
Yeah.
This is really interesting. This is going to be, so we have a plan for these next 3 months, what I need to do to feel better. And then next year we start the Borrelia.
This is my mission. Everything what I went through, this is not for suffering, this is for purpose. This is for be able to give you. Thank you.
Thank you.